It's the second part of antiplatelet antithrombotic therapy of ischemic stroke. If there is presentation within 3.5 to 4 hours of the symptom onset and there is no contraindication of antiplatelet antithrombotic therapy, give intravenous altiplase. Stroke with no prior antiplatelet therapy, give aspirin. Stroke on aspirin therapy, add dipyridamole or clopidogrel. Stroke on aspirin therapy and platelet with intracranial large artery atherosclerosis. If there is intracranial large artery atherosclerosis, give aspirin and clopidogrel. Stroke with evidence of atrial fibrillation, go for long-term anticoagulation like warfarin, dabigatran, and rivaroxaban. Patients suspected cerebellar stroke, like if there is vertigo, gait disturbance, are treated with thrombolysis even in the absence of classic stroke symptoms like weakness, like aphasia. Um, Thrombolysis administered. Before thrombolysis administration, you have to look at the blood pressure. Prior to administration, blood pressure should be less than 185 by 100 millimeter of mercury. Lower BP2 less than 185 to 110 millimeter of mercury. After administration, maintain these blood pressure less than 180 by 105 millimeter of mercury for 24 hours. Thrombolysis not indicated. Where if there is allow permissive hypertension and lower extreme hypertension, like if there is systemic blood pressure is more than 220 millimeter mercury, diastolic is more than 250 millimeter by 15% in the first 24 hours, and that case thrombolysis not indicated. So initial management is ischemic stroke management following thrombolysis: intensive monitoring, frequent neurologic examination, strict blood pressure control, keep the blood pressure less than 180 by 105 to decrease the risk of hemorrhagic transformation, avoid hypotension to maintain perfusion to ischemic penumbra, and wait more than 24 hours prior to initiating antiplatelet therapy or anticoagulation. Potential complication: there may be intracerebral hemorrhage, systemic bleeding like GI hemorrhage, and bradykinin induced angioedema may happen.